sometimes an approach will take, which will be to take the naltrexone pill and to cut it into the smallest piece we can do and give just a little bit of that after your system is clear of opioids. And then that may precipitate a little bit of withdrawal, and then we'll, over a course of several days, give gradually more of that naltrexone and build up to the shot, okay? Depends a little bit on how you're feeling, on how you're doing. If your withdrawal symptoms are pretty mild after the buprenorphine, we might do that faster to just get you to the shot faster. If your withdrawal symptoms are terrible, we might wait a little longer so we don't give the naltrexone to kind of precipitate withdrawal symptoms. When you come in, we'll do this rating scale. We'll ask you a bunch of questions and measure withdrawal symptoms, so we'll kind of get a sense of how you're doing and how well the other medicines to treat the withdrawal are working. And then we'll build up to it. In some cases where people are still in some withdrawal and they're just really afraid they're going to relapse and they just want to get to the shot, we can just do the shot faster, and then that might cause more withdrawal symptoms as a result of the shot, but then they'll be protected. They won't be able to feel any opioids. So we have a little bit of discretion on how we handle the after buprenorphine process, but in general, what we do is we have you not use any opioid for a day, sometimes two, and then try to introduce a little bit of the oral naltrexone and build up. But there are ways that we could adjust the plan depending on how you respond to that. So I know I gave you a lot of information. I don't know if you have any questions about that.
Will I get all those other medications you mentioned that will help with the withdrawal symptoms every day, or is it just that one day?
Well, we'll give them every day.
Okay.
And I'm not going to get, I probably am going to give you a prescription every day to fill them, like maybe a day or two. I'm not going to give you like a whole pile of them at once, because I want you to kind of stagger them. I also meant, for diarrhea, sometimes we use Imodium.
Okay.
And for nausea or vomiting, sometimes we use Compazine. So it depends on how your withdrawal symptoms manifest themselves, like what we want to do. But for most people, the clonazepam and the clonidine and the sleeping medicine is like the core of it. It helps. I don't I don't want to say it eliminates it entirely, because it doesn't. And so that week, I really need you not to have anything happening that you're going to need. You don't have to be here in the clinic all day long every day, but I need you to come in for at least part of the day every day. But you're probably not going to feel up to doing much else. Okay, and then we'll build up to the injection. If it just doesn't work out, sometimes when people are that sick, they wind up using. We can either restart the process again. If it didn't work twice, we might then have to think more about going to residential treatment, or just buprenorphine, even though that wasn't your first choice. So, do you have any questions about?
No, I'm excited to give it a try.
Okay. Well,
Yeah.
I'm glad you're here, and I think this is, it's hard to know how this will play out, but I think if you're motivated to get help, we're going to be able to figure out some solution for you.